This video is part 3 in our soft tissue-based hip injuries presentations. In this video, I'm going to be covering the role of the posterior hip capsule in the injury presentation and palpation and functional-based treatments. What's up, everybody? For those of you that don't know me, my name is Dr. Matt Maggio. I am the creator of the 𝐓𝐡𝐞 method and the founder of the soft tissue revolution, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. This video is part 3 in our soft tissue-based hip injuries. In part 1, I covered clinical presentations and functional-based testing. If you're watching that on YouTube, I'll link it up right now above. If you're watching this on LinkedIn or Facebook, I will put it in the comment sections below. And in part 2, we covered the adductor magnus, specifically palpation and functional-based treatment. Once again, if you're watching on YouTube, I'll link it right up here. In Facebook, I'll put it down in the comments below. The posterior hip capsule, it kind of sits on the back part of the hip. It's technically considered a ligament. I put it in that soft tissue realm as well. And the first thing we need to do is we need to be able to actually find it, because if you can't find it, you can't fix it. So what I want to link up first in this video is a detailed functional-based palpation using landmarks to find exactly where that posterior hip capsule is and where it's getting dysfunction at. So the next thing we're going to look at is the actual hip capsule itself. So it's a ball of ligaments that comes back and it goes through here. And a lot of times that gets loaded up with a lot of scar tissue. When it gets a lot of scar tissue, it can't lengthen how it should. And a lot of people will get some pain out in the hip. They'll even get some swelling when this is causing a problem. So this one, what we do is we roll up to really expose that. And then what I like to do is put the hip in a little bit of flexion just to let it slacken. And then we get in here and we landmark as we do. So first thing I find is the greater trochanter, and you can't miss it. It's right through here. And then what I find is the back part of the trochanter. Right here, I'm still hitting on bone. And the next thing that we do is we pick up our thumb and go just in like that. Now we're able to really sink in and get on that hip capsule. It's right underneath there. And the way I get my palpation is I come in with this hand and back it up, and then my drive is to come in with this hand, and then I tension it with that hand. So drive comes here to palpate, and then here, and then you're feeling if that is really jammed up. And this area is so important and so dysfunctional in a majority of hip problems and hip cases. The problem is people don't actually get on it. They're either too close to the bone or they're out in the lateral part where the sciatic nerve and the superior gemellus lives. It's right in between there, and opening up this hip capsule can make a big difference. A couple take-homes just from the palpation video. Number one is just slow down. Don't be in a rush to want to jump right in and do a bunch of treatment, and use landmarks. Those bony landmarks really help you find exactly where the problem is and where that tissue is, because I said it earlier, if you can't find it, you can't fix it. So slow down, palpate. Don't be in a rush to just want to jump right into treatment. Get in there, find that area, slow down, keep saying slow down. It's really, really important. A couple injury presentations when there's dysfunction in that posterior hip capsule. One's just going to be when they say impingement. Someone's like, oh, I have hip impingement. It doesn't really tell us a whole lot of things, but a lot of times when that capsule is jammed up, especially when they bring their leg back, it can give some of that anterior pinching feeling in the hip or in the side as well. Also, when that capsule has some issues in there, it puts more pressure on the joint and cartilage, and it can cause the hip to have some popping and some clicking. And lastly, it can just present with hip bursitis. A lot of people hear bursitis and they're like, oh, there's some swelling in there. They don't really know what's going on with bursitis. I talk about this a lot in other videos. Bursitis is actually the effect of something going on. It's not the true cause, but when that capsule isn't working right, it just puts a lot of bad biomechanical disadvantages on the hip joint itself and can cause a lot of issues. So the next video I want to link up is a very detailed functional-based treatment of the posterior hip capsule using my treatment called manual scar tissue treatment. I'm going to link that video up right now. Now we're going to get in here and treat the hip capsule. Once you've cleaned up the adductor, now the hip capsule is very important. Now the key is actually the position of the client. You want to have them stacked up just like this, and you actually want them to scoot towards the bottom of your table on the very edge. So come down just a little bit more, and they'll be set up just like that. And what you're going to do is take this back leg and let that go here, and the leg is going to rest right up against the table. Now the motion here is the client is going to start by keeping their leg on the table And they're gonna slowly bring that up through here. And you can even have them reach down with their other leg behind the hamstring and finish off the rest of that motion, because we're gonna get what's called hip flexion to open up in there. So what we're gonna do is have the client move up like that, and then when it gets close and they can't go any further, they're gonna reach under with their hand and pull their leg up to finish off the rest of that motion, because we wanna get full flexion in here. This is the test that we're fixing. Now, watch the palpation video in how to get on the hip capsule. If you don't get on it, you can't treat it. Now, the key here is actually your body mechanics and how you approach it. So anytime you're treating the capsule or the lower part of the hip, you want to approach it at about a 45-degree angle to get that to open up. You've gone through the palpation to find that. So you found the greater trochanter, you found the backside of the trochanter, you sink in just like that. And that's right where that hip capsule lies, and you found it. I've already taken the client through the motion so they know what the motion is and they know how to do that. Always check with them to make sure they have it right. Now the key here is going to be your body and how you set up. So what I like to do first is I just have my thumb nice and relaxed in here. And come over a little closer. I have my thumb nice and relaxed in here, and then I'm going to back it up with this other thumb. And essentially what we're going to do is we're going to get some depth in here, and then we're going to get some tension on that as well. So to start, you're going to line up right over top of it, and I get a nice wide stance here. That allows everything to relax. And what I want to do is have my arms nice and straight, and I'm going to lean in with my body. That lean in is where you're going to get your depth. And for the capsule, you want to get more depth. So you're going to push with this arm just like that, and then your tension is going to be a counterclockwise kind of lean like that. You're going to hold that, and the client's going to start to do that motion. Go ahead. And it'll pull right away. And you're going to stay right over top of it, just like that, and they're going to open that up. So like we said, the key is getting your body over top, and I'm very strong in here. I'm up on my toes, and I sink in, and you'll see my elbows start to bend as I sink in. And once I do that, I push in with the other hand, and then I get my tension with almost a lean, just like that, and the client goes ahead and moves, nice and slow, and when this is bad, it's bad. They're going to finish off that motion. You're going to hold it at the end for a count of maybe 5 or 6 seconds. Now the key, I want you to see this. Come a little bit closer. I want you to see how my feet are. So the key here is a couple things. As we're sinking in, I'm getting my depth by going here, but my tension is actually a pivot with my feet. So I'm here, and I pivot like that. And as the client moves, go ahead, I'm going to kind of go around and go here, because the whole time you want to keep your sternum over top, because that's where you have your power. So you want to kind of track with that as that goes. So it's kind of a shift in here. And a good way to practice that would be in the morning when you're doing one of your warm-ups, and you've seen that video. We'll practice that as well. That's going to set you up for sciatic nerve and for capsule.
Couple take-homes from the treatment video. Once again, slow down. Don't be in a hurry. I always say, in order to go fast, you must start by going slow, then understanding the concepts of proper depth, then tension, then having the client go through a full range of motion. You know, on the surface, a lot of my treatment looks very similar to myofascial release, but the difference is getting the proper amount of depth and then the right amount of tension, and having that client go through that range of motion. That's what actually breaks down that dysfunction in there and allows for a more effective treatment. You know, a lot of myofascial treatments, they're actually way too compressive. They don't get enough tension. It hurts like hell. You think you're doing something because it hurts the client, but it's really not doing anything. It's just jamming that tissue in there and really pissing it off. A few just take-homes and wrap-ups from this whole 3-part series on soft tissue-based hip injuries. Number one is just the importance of critical thinking. Asking the right questions, using your brain before you ever go in there and start to treat. It's going to help you figure out exactly what the problem is and do a more systematic and detailed approach, almost methodical in finding and fixing the problem and getting long-lasting results. Once again, just slow down. You know, so much treatment is what I call a shotgun approach. We just do a bunch of stuff, throw a bunch of stuff at it, see what happens. We never really know what's going on. I want you to be more of a sniper where you find exactly where it is, you line it up, you do the exact right treatment that it needs, you go in there and get that kill shot, and it's functioning and moving much better without putting a lot of extra wear and tear on the client and their body and their injury. And the other thing is, instead of doing more treatment, do less treatment, but better quality treatment. Going forward, it's going to be better for you, it's better for the clients, and it gets better, long-lasting results. So if you enjoyed the video, let me know what you think in the comments section. If there are any specific areas you want me to cover, send me a message. Always here to help. Share this video with anyone else out there that you think it can help. Go grab our free training. We go a lot into critical thinking, advanced palpation, even some functional based tests of all different areas and throughout the entire body. And lastly, once you go through that free training, you really like what you see, you can come take one of our CEU courses. They are available both in person and in online. And it really helps you get from that idea of being a service provider to a true solutions provider. I appreciate you guys watching the video and sticking along during the series, and I'll see you on the next one. Bye.